Welcome to our virtual hangout tonight. I'm really excited that you're here. This is a new topic that we will be focusing on. So we're really glad that you are joining us. So I'll give registrants another minute to log on, but we're really excited to have you on the special topic of oncofertility this evening. So if you want to pop into the chat, feel free to put where you're tuning in from. We will be recording this evening's virtual hangout and it will be available on our UFH Connect video library. So feel free to come back and rewatch or share this link with anyone that may find this discussion helpful. And I am very excited to be joined by my esteemed colleague, Nina Richrovado, this evening. Many of you may know Nina from connecting with her and her team for our wellness program. So I'm very excited to have you here tonight, Nina.
Thank you. Thanks for having me join. Good to see everyone.
Yeah, wonderful. So if this is your first time joining one of our education segments, my name's Erin Pellegrin. I'm usually hosting with our founder, Sue Weldon. I also lead our dietitian team. And hopefully you are following along for all of our education events that we are hosting throughout the month of September. We have quite a bit coming up even this week, which I'll touch on in just a moment. But before we get there, I want to make sure that I give appropriate thanks to our education sponsors. We are so grateful to those that continue to offer ongoing support to our entire education initiative. So this evening's virtual hangout is presented through UFH Connect by West, Merck, Lilly, Novartis, and Gilead Sciences. We have additional support from our gold sponsors, Pfizer, GSK, and Daiichi Sankyo, and ongoing support from AbbVie, Terri Therapeutics, and Veristem Oncology. So we are so grateful for their ongoing support, like I said, regarding our entire education initiative. So for tonight, Nina and I will be watching the chat as our discussion moves along. Like I said, feel free to put in the chat where you're tuning in from. And raising your hand, we may have a smaller group this evening. So once we get to the Q&A session at the end, feel free to raise your hand and ask questions or just share your experience if you would like. So before we jump into our segment and I introduce our panel of speakers tonight, like I said, we've got a lot more to come in September. So this is not the last you will see. So let me give some reminders on what else is happening. So we've got 2 education events happening tomorrow, Thursday. So one of which is happening during the day. It's our Ask the Experts segment. I will be joined by my colleague, Aubrey Red, one of our clinical dietitians. We will be streaming live to Unite for Her's Facebook page, and we will be streaming at 1 p.m. Eastern Time. Our topic is clearing the confusion about supplements and cancer. So we will be joined by fellow registered dietitian Natalie Ledesmy. She is out of San Francisco. She is a specialist in cancer care and has a very extensive knowledge of supplements. So we are really excited to tap into her brain and answer as many questions as we can about the most common supplements that our dietitian team hears from our Unite for Her community. And then following that, tomorrow evening, we have a speaker series at 6 p.m. Eastern Time. Myself, I will be joined by Nina's coworker, Melissa Christie, also from our wellness team. And we will be with one of our cardiac specialist physical therapists touching on cardiorespiratory fitness and cancer. So just talking about the benefit of fitness and cancer, preserving heart health. We know some of the chemo regimens can be cardiotoxic. So Nikki will be sharing with us how movement and exercise can help to preserve long-term cardiac function. So that will be happening tomorrow evening at 6 p.m. Eastern Time. Just like this evening, both of our events will be recorded and in our UFH Connect video library. We can put that link in the chat so you can come back and watch all of our segments in our library. All right. Shall we get started this evening? I think we're in a great place. So let me start by introducing our panel and who we will have sharing some information and discussion this evening. So first, I want to introduce Dr. Terri Woodard. So Dr. Woodard is a professor in the Department of Gynecologic Oncology and Reproductive Medicine. She's also the director of oncofertility program at the University of Texas MD Anderson Cancer Center. She also holds joint appointment in the Division of Reproductive Endocrinology and Infertility at the Baylor College of Medicine. In 2012, Dr. Woodard founded the MD Anderson Oncofertility Program in conjunction with Baylor College of Medicine, Texas Children's Hospital. This program offers comprehensive fertility and family building services to men, women, and children diagnosed with cancer. Her research interests include tracking oncologic and reproductive outcomes and exploring ways to educate and support patients as they make decisions about fertility preservation. We're also joined this evening by Tamara Scott. She is diagnosed with stage 2 triple negative breast cancer in July of 2024. In her 30s, with no family history, she was shocked to hear the news after finding a hard spot on her chest on her birthday. She has since gone through a year of treatment, including 6 months of chemotherapy, 2 surgeries, and a year of immunotherapy. She's enjoyed sharing her journey on social media to connect with and help other breasties. And now that she's done treatment, she's excited to get back to running, traveling, and spending more time with friends and family. And then finally, we have joining us this evening is Megan Scherer. Megan is the co-founder and executive director of Worth the Wait, a national oncofertility nonprofit. Megan advocates for patients and oncofertility nationally as a speaker and a patient advocate. She enjoys the personal relationships she forms with young patients Worth the Wait assists and loves providing hope and inspiring others with her story as a caregiver, infertility patient, and mom to son Elliot. So I am thrilled to be joined this evening by our incredible panel. Thank you all for joining me tonight. Excellent. So Dr. Woodard, why don't we start with you to lay the groundwork in terms of fertility preservation, family planning, and the information that you often share with your patients.
Okay. Thank you for the invite. I am so thrilled to be here to talk about something I love to talk about. Feel very passionately about education, especially in this area. I'm going to try to do this quickly. I don't have tons of time, but want to just walk you through some of the fertility preservation methods that are available and kind of the things we think about as patients decide whether to pursue them or not. Okay, can everyone see my slides? Just want to make sure. Okay, great. Why are they not advancing? Okay, there we go. Sorry about that. So why are discussions about fertility important? And really, it's because there are quite a few young people, as we describe them, we call them AYAs, adolescents and young adults with cancer between the ages of 15 and 39, who are diagnosed with cancer. And in 2025, over 85,000 people are estimated to be diagnosed with cancer between those ages. The fortunate thing is that we can expect that most of those patients will survive their cancer. There's about an 86% survival rate. And we know from the literature that fertility is a priority concern for many of these patients. And most patients kind of have a predetermined expectation of becoming a parent. They thought, oh, this is something that I would do eventually. And we do also know from the literature that survivors express a desire to have children, and the preference is for them to have biological children compared to third-party reproductive options and adoption. And then finally, we know that cancer-related infertility is a significant source of long-term emotional distress and decreased quality of life. So a lot of times we'll talk to young women and men who said, you know what, I could deal with the cancer diagnosis, I could deal with the treatment, but the fact that I'm unable to have my own children makes this really hard. So now I wanted to talk about kind of a few key points about timing, decision-making, and collaboration among care providers. So I really like to take a global approach at looking at this. You know, patients are bombarded with a new diagnosis. They're making huge changes in their life with their school and work schedules. And often I'm trying to get them to think beyond this initial period all the way to when they're actually starting their family building process. As a fertility specialist, I love when my patients are able to have children, but I really do think that the most important thing that I do is educate. And it is our responsibility. And there are multiple guidelines out there that exist that state we should be doing this work. The most common one that you'll run into is the ASCO guidelines, which were recently updated. But the big thing is to remember as clinicians and care providers is to initiate the discussion about fertility preservation as early as possible in the course of treatment planning so patients can have the most options available to them. You can do a brief overview of what those fertility preservation options could look like. And if patients are interested or even unsure, please refer them to reproductive specialists to see what is right for them. I will say that decision-making surrounding this, especially for women, is very complex because they're often dealing with competing priorities, time to start chemo, cost, whether it's safe or not, and teamwork as providers is really key to making this work. I don't want to downplay the fact that access is a major barrier, both in terms of geography as well as financially. A lot of patients don't have insurance coverage for fertility preservation, so that is a huge barrier for a lot of people. And then the final point I want to make is that this should be a continuing discussion throughout the cancer journey and well into survivorship. So briefly, how can cancer impact fertility? So there may be surgery that's happening in the abdomen and pelvis, especially in gynecologic cancers where reproductive organs could be removed. There's radiation, similarly, abdomen, pelvis, but sometimes people don't think about the brain. If people have radiation to the brain, it can interrupt the hormones that regulate fertility in both men and women. And then, of course, the big one that everyone always thinks about are the anti-cancer therapies. So this could be chemotherapy and the newer targeted agents and immunotherapy, where we don't even have a lot of data on how it may impact infertility in the long term. And then finally, a category that people don't think so much about is that there is genetic risk for some patients with cancer because they're at increased risk of other cancers, and this also can be passed along to their offspring. So this is a busy slide, but I want to briefly run through the fertility preservation options. And I know there's not probably a lot of males on this particular virtual reality hangout. But for males, the standard of care, if they're an adult, is to sperm bank. If a man has had a vasectomy or cannot ejaculate sperm, we can actually do something called a TESI, which is a biopsy to get sperm. And then for prepubertal boys, the only thing that we can really offer them is something that's considered experimental, and that's called testicular tissue freezing. For women, what most women, if they do try to do fertility preservation, the standard of care would be assisted reproductive technology, which includes both oocyte and embryo cryopreservation. Briefly, this is stimulating the ovaries to provide a larger number of eggs that we can retrieve at one time. And this process takes about 2 weeks and can be quite expensive if it's not covered by insurance. Other options include ovarian tissue freezing or cryopreservation, where we take out a portion of the ovary. And if a woman becomes menopausal or infertile post-treatment, we can put that ovarian tissue back and it can function and she can get pregnant. Another common thing you will see, especially in the world of breast cancer, is ovarian suppression with GnRH agonists. So this is giving an injection either monthly or every 3 months to shut down the ovary, with the thought that an inactive ovary is more resistant to the effects of chemotherapy than one that is actively cycling. And then there are some other things like ovarian transposition. If someone's getting radiation, you can hike the ovaries up into the abdomen instead of leaving them in the pelvis, so there's less radiation damage to the ovaries. And then, of course, for gynecologic cancers, which often can go along with breast cancer, specifically ovarian cancer, there are some conservative management options where gynecologic oncologists won't remove the entire female reproductive system, but leave some behind so that a patient can try to achieve pregnancy. So I just want to talk briefly about some of the unique attributes of assisted reproductive technology and what might make them a bit more not easier, but more effective for patients with cancer. So one benefit is that it allows for pre-implantation genetic testing on embryos. So if a patient has a deleterious gene mutation, meaning a gene that can cause cancer in their offspring or obviously in themselves, we can do pre-implantation genetic testing on the embryo. And there's two types. One is PGT-A. A stands for aneuploidy. So that's biopsying an embryo and telling us whether that embryo has the normal number of chromosomes or not, and whether it's male or female. Then there's PGT-M, and that stands for monogenic, and that is looking for a specific gene mutation in that embryo. So if a patient comes to me with BRCA and says, hey, I don't want to have a baby and pass this on, I want to test my embryo to see if it would be affected, we can test the embryo for the BRCA mutation. The other thing that I think is important is that when you do ART, you can use third-party reproduction, including gestational carriers. So, you don't know what your cancer journey is going to look like. Maybe your doctor's not going to want you to get pregnant, or maybe you have late effects that make pregnancy very risky for you. In that instance, if you have eggs or embryos, those can be used to transfer an embryo into a gestational carrier who can safely carry that pregnancy for you. And some special considerations for women with cancer. I'm often asked, is it okay to wait a few weeks to do this? And it used to be that we had to start cycles with your period. We don't do that anymore. We do something called random start cycles, where I can see a patient today, start them on meds tomorrow, no matter where they are in their cycle, and be done in about 2 weeks. The other thing is sometimes we'll do back-to-back cycles where you stimulate someone, and then even like 5 days later, you can stimulate again to get a larger number of eggs in a shorter period of time. So just to talk about some of the other emerging strategies for fertility preservation that are out there. Some of them are relevant to women with breast and ovarian cancer, some are not, but just to show that this is just an exciting field is, again, I talked about ovarian tissue freezing. So one thing they're trying to do is figure out how to take those very immature follicles from ovarian tissue and mature them into mature eggs that can be used for IVF. There are people working on an artificial ovary that can provide the environment for oocytes that are not quite mature yet. And then actually now I talked a little bit about ovarian transposition, where we hike the ovaries up into the abdomen. People are now doing uterine transpositions for women who are getting lower abdominal pelvic radiation. And actually I have a picture here. They hike the uterus up and connect the cervix to the belly button. So actually someone has their menstrual cycle through their belly button. And then after they've done their radiation treatment, they move the uterus back down in place. And actually there have been live births from this procedure. And then the final one is actually uterine transplant. And to date, it hasn't been really used for cancer patients. But a recent review suggests that women with gynecological cancer may soon be candidates. There are some drawbacks to this, of course. It's a huge procedure, but it is exciting to know that options are continuing to develop for women with cancer. So to end, what are some key facts that I hope patients remember as they think about this? One is that fertility preservation is not a commitment to parenthood. It's just kind of broadening your chances. Outcomes are not guaranteed, so you have to remember that. You can freeze your eggs, you can freeze your embryos, and it still might not work. But if you don't have anything, that's no chances. And as long as you are informed, the decision that you make is the right one for you. So a lot of times I'll sit with my patients and say, hey, my job is not to convince you to freeze your eggs or anything. My job is to make sure you make a decision that you are comfortable with and that you can live with, and you've had all the information you need to do that. And then I always want people to know that no matter what happens, there's always potential for other fertility and family building options. So a significant number of patients I see might not have had these conversations or were too sick to do anything. We can talk about what we can do next. And they might have to reframe how they thought about building their family. But when there's a will, there's a way, and we can help them achieve that. And with that, I will close. Thank you.
Oh my gosh, that was amazing, Dr. Woodard. And I just appreciate the reinforcement of, having these conversations, assuring patients that there are options, even whether you're having this conversation early on or later down the line, there are options for those that are interested. So I appreciate you. I appreciate you sharing, and so exciting. Thinking about all of the new advances in fertility preservation and what's available, it's really hopeful. I love that. Okay, so with that, I think, having this panel discussion and understanding what is important to us, we wanted to make sure that, we bring the perspective. Dr. Woodard had mentioned this, some of the challenges that come across about discussions and certainly access and financial aspect to that. And so part of this discussion, we thought it would be important to share that patient perspective as well. And that's where we're joined this evening with Tamara Scott. So let me bring Tamara on with me. Thank you so much for being here this evening. And if you wouldn't mind just sharing your personal experience with fertility, decision-making, and what that process was like for you.
Sure. So thanks for having me tonight. I am thrilled to be able to share my perspective of when I went through last year at the beginning of my cancer journey. So as Erin mentioned, I was diagnosed in July of 2024. I was diagnosed with a rare aggressive form of breast cancer called triple negative breast cancer. And because of that, I had to start chemotherapy fairly quickly. The biggest delay in getting started was getting approved by insurance. So therefore, I was able to have about 2 weeks to go through my fertility journey. And so when I was diagnosed, a couple days after I found out, I had a slew of appointments with various providers, including a fertility specialist. And I remember we met around lunchtime one day, and she said if I wanted to get started, I would have to come in the next morning around 7 a.m. And so I had less than 24 hours to decide if I wanted to go through with this process. And part of me thought, you know what? What's done is done. Should I stress myself out? I have this new diagnosis. Is it worth it to be going into all of these check-ins regularly, the additional costs, things like that? But at the end of the day, the literal first day that I had to decide, I realized that the decision being taken away from me was upsetting. And if I didn't do something now in order to try to preserve what I could, I might be upset with myself later on, no matter what the cost was. So I did decide to go through with fertility, my fertility options that I had available to me at the time. So I started the next day at 7 a.m. And from what I hear, other people spend months planning their fertility journey. But when I walked in that door, I had no idea what was ahead of me. And so all of the workers there were so lovely and so comforting, especially being so early on in my cancer journey and being very emotional and overwhelmed with all of the information that I was receiving from various medical professionals. And so they explained everything to me. It was a lot of information, a lot of unknowns, which is not unique in the cancer space. And just tried to do their best to walk me through what I could expect. And while I did, and I still do have pretty good insurance, and I actually did have some coverage that was listed for fertility treatments, it still has been one of the most expensive parts of my cancer journey process. And that included the medications, a lot of the medications that I had to pay for to go through fertility treatment. The egg extraction was covered by insurance, but the egg freezing was not. And because I did not have time to plan what medications I might need or when, it was really on a day-to-day basis. A lot of the medications I had to pay for out of pocket and pretty much on demand, on the spot, run to the hospital pharmacy pick up the medications and then take them for that day or the next day. So it really was a lot to really think about, to go through. And in the end, I'm glad that I was able to do it, but it was pretty scary because having cancer, my body did not respond in the way that the doctor had hoped or would expect for someone who was healthy. So I had to go in, for those who have not gone through fertility preservation, you are expected to go in for check-ins pretty frequently during a 2 or 3 week period. And when you have cancer, I was expected to come in even more. So almost every morning I was going out to the clinic to get blood work, to get tested, to see how my body was reacting to the different medications, and if I was even going to be able to harvest any eggs. And excuse me if I'm misquoting some terms and things like that. It has been a year since I went through the process, but in the end, I was able to extract 5 eggs, and all 5 of them were able to be frozen. None of them had any genetic testing on them yet. But everyone was pretty pleased with me being able to extract as many eggs as I could, given that it was such a rushed process, unexpected. I wasn't taking any vitamins or supplements. Maybe the call for tomorrow would have been beneficial for me back then. But I got what I was able to get, and still paying it off. But I was happy that I was even given the option, because some people who have breast cancer at a younger age, the type of cancer that they have, they can't always even do some sort of fertility preservation. So I was even fortunate in that sense that I was able to do so. So I'll pause there. Erin, I don't know if you have any questions or anyone else has any questions, but I'll pause for a moment.
Yeah, I love thank you so much for sharing, and it's very lovely to hear that you were able to retrieve 5 eggs, and like Dr. Woodard said, going through this process is not a guarantee that you have to do anything with it, but just having that option so you can ultimately make the best decision for you. So wonderful to hear about that. I'm curious, and maybe you mentioned this, that fertility process from start to finish at the beginning of your diagnosis, how long did that take start to finish? And or is there a typical time frame? Maybe Dr. Woodard, you can jump in as well regarding what that looks like before treatment starts.
So for me, as I mentioned, I had less than 24 hours to get started. But from that first day that I walked into the clinic until the day that I had my eggs extracted was exactly 2 weeks. It was a Wednesday to a Wednesday.
Wow.
Yeah, that's probably about the average, usually about 10 days of stim. 2 days later, you have the retrieval. So I usually tell patients it's going to be anywhere between 9 to 12 days of stim plus 2.
Wow. Okay. And Tamara, you mentioned that even given the type of cancer that you have, it was surprising that you were successful and able to go through that fertility process. Dr. Woodard, if you might be able to elaborate a little bit on what types of cancer diagnoses may make someone not a good candidate for fertility preservation.
Yeah, so triple negative breast cancer, especially if it looks to be a little more aggressive, which it tends to be, we're very careful to make sure that the oncologist is okay taking the time. The other big one is inflammatory breast cancer. Usually when I see that diagnosis, I know that the oncologists are not usually supportive of the woman taking the extra 2 weeks. They want to start chemo right away.
Okay. And is really that the driving factor, the imminent need to get treatment started versus holding off for 2 weeks?
Yes.
Okay. If anyone has any questions or would like to come off of mute as well, you're certainly welcome at this time. We will be sharing, a common theme that has come up this evening is access and the financial burden with all of this. So certainly we'll be sharing Worth the Wait's mission and how they help this population so importantly. But if anyone has any questions or comments or wants to share in the chat, you're welcome to do so now and throughout the rest of our segment as well.
I will say, as Dr. Woodard mentioned, the ovary suppression. So I did also go through a shot called a loop. In my case, it was a Lupron shot, and I did that every 3 months during treatment in order to try to preserve, shut down my ovaries and preserve what we could. At this point, it's been probably 7 months since I stopped chemo and stopped that cycle of Lupron, and I have still not gotten my period back yet. So that was also definitely a big concern for me, is given my age in my mid to late 30s, would I even get my period back? What would that look like? So I'm still waiting on that. So more to come. But hopefully that'll come back at some point, because the other thing that my doctor told me is that it's not recommended to even try to have to give birth naturally until you're out of treatment for a certain period of time as well. So that was on my mind too as I was making the decision.
And that's actually, I'm glad you brought that up, Tamara, because I think oftentimes when we think of fertility preservation, we're thinking of that front-loaded time, right? Initially at the beginning, and making sure you have an egg retrieval, but the post-treatment, that after timeline, maybe Dr. Woodard, you can provide a little bit more insight in terms of what that looks like, and just because there may be eggs retrieved may not always mean that they could be implanted down the line. So the post-treatment timeline and what you're looking for, what does that often look like for a patient?
Yeah, so this is something we talk with our patients about at that first visit. So for instance, if you have an estrogen receptor positive tumor, they're pretty much going to want you to be on tamoxifen for at least 18 to 24 months. It gets you out of the window of an early recurrence, and B, that's based on a recent trial that many of you may have heard of, the positive trial, which showed that women with early stage estrogen receptor positive tumors could safely stop their endocrine therapy, which is normally 5 to 10 years. They could stop it after about 18 to 24 months and safely try to conceive without compromising their oncology outcomes. So the other thing I think is important is I work closely with the maternal fetal medicine colleagues. So these are OBGYNs that did extra training in high-risk pregnancy. And they do a preconceptual consult to kind of look at what the patient's history is, what medications they're on. They try to optimize everything, because some chemotherapies, have late effects that might affect the lungs, the heart, and pregnancy is a stress. It's a stressor. So just making sure that women are prepared as they try to conceive for what might be ahead of them. So yeah, that is definitely part of our counseling. And then of course, the oncologists, we like for them to weigh in, because occasionally there will be women that, they say, no, I never really want them to get pregnant. So then we're having to talk about some other options in addition to that.
Okay, wonderful. Thank you for sharing that. Excellent. Okay. Well, I think it's a good time because, one of the things we like to also make sure is available to our Unite for Her community are the resources that are available. So, as I said, a recurring theme that is a challenge to this population may be access, certainly the financial burden. And we are so honored to be joined this evening by a nonprofit partner that works to help bring access to fertility preservation to any cancer patient. And I am so honored to have met Megan and been connected, and have you as part of the Unite for Her resources. So Megan, I know you'll be sharing a little bit about Worth the Wait and what is available to the cancer community. We are so grateful that you're here with us tonight.
Thanks so much for having me. And Dr. Woodard, thank you so much for explaining things such an easy to understand way. And Tamara, for sharing your story. It's so brave. Not enough people are talking about oncofertility. So the more we can do to normalize it, the better it will be for all patients.
Absolutely. Okay, well, let me jump on and I will share your slides.
Thanks,
Give me
Erin.
1 moment. You're welcome.
Yeah,
and I know
and I
we'll
can
be
go ahead
sharing
and
the link. Yeah, you can get started, and we will be sharing the link to your website, so you can look for
Great.
that in the chat as well.
Awesome. So, I am a former caregiver and partner to a cancer survivor. My husband was diagnosed at 26 with testicular cancer. We were really lucky because his oncologist talked to him about sperm banking. So he went through, did that. And then once he was well again, we had the conversation of, what does this look like? We have this sperm. What is our journey? And unfortunately, it was a really hard journey. Even though we had that as somewhat of an insurance policy, it took us several years and many, many rounds of different fertility treatments to be able to have our son. So that middle picture there is my son Elliot when he was born. Flash forward, this was us on summer vacation in northern Michigan. So he is an absolute joy. And once we were able to have him, Mike and I said, we need to make sure that other young adult survivors have this opportunity if they want to become parents and to really keep that hope alive. We know that hope is such a powerful thing. And like Dr. Woodard said, everybody's worried, right, when they get a cancer diagnosis, but the amount of people that share their stories with me and say, I wasn't worried about surviving, I was worried about not having the survivorship and the future family that I've always dreamed of. So we started Worth the Wait 4 years ago, and our mission is to ease the financial burden when it comes to fertility preservation as well as family building. We were much more focused on the family building because that was where we spent, the greatest amount of money and time and energy in our journey together. But as we started, talking to people and listening to their stories more, we realized we better do something about fertility preservation too, because if you don't have that option, your options are a bit limited in survivorship. So Erin, if you don't mind going forward, Worth the Wait, we have 3 pillars that go with our mission of empowering young adult cancer survivors on their path to parenthood. So education, we've got different programs and we partner with wonderful nonprofits to just raise awareness about oncofertility. We do advocacy work. We're actually getting started to hopefully get some coverage from insurance companies for patients in Ohio, where I live, and then also financial assistance. So if you want to fast forward, I can talk to you a little bit about our program. So we have 2 different types of grants available to adolescent and young adult cancer patients and survivors. The first one is emergency preservation grants. So like Tamara had mentioned, she had 24 hours to make a decision, and just wrapping your head around, first off, do I want to have this option available? And how in the world am I going to afford this? We talk to so many people that their fertility clinics, require upfront payment. And if you don't have insurance coverage and I remember we put like $10,000 on a credit card and we were like, oh my gosh, this is the craziest thing ever, right? To just jump in and fully commit to this. So our emergency preservation grants are for people that do not have children already. They have no fertility coverage. They can live anywhere in the United States. And so we have an online application process and we're able to turn those around quite quickly. I know you said you'll be sharing our website, Erin. It has all the information, it has all the timelines around how quickly you can get a response for us. That's really important because we applied for some, IVF type grants and things like that. And it was sometimes we'd never hear back. And we just thought transparency and that personal touch was really important to us. So those are part of our core values. When we talk about emergency preservation, we're basically talking about all the things that Dr. Woodard mentioned. So we've given grants for ovarian tissue cryopreservation. That's typically younger patients, but we've even helped, I think, 23-year-old we helped with that. She was too ill to go through with an egg retrieval, so she did that instead. Egg, sperm, and embryos. And then on our family building grant cycle, we have 4 family building opportunities a year for people to apply. Same criteria, but those grants can be used for long-term storage. We know, not only perhaps you could be in debt from, paying off that egg or embryo freezing, but that long-term storage can really get expensive. So we've had grant recipients use their money for that. We've done adoption, surrogacy assistance, as well as donor eggs, donor sperm. We actually just we welcomed a new worth the wait baby who was conceived through donor sperm. So we just, every time we hear a new situation that we haven't helped out with, we're like, well, yeah, why wouldn't we help with that, right? If they meet the criteria, and that's the way that they're choosing to build their family, like, we're on board about, empowering people, whatever it looks like. So you can find out all about both of those grant programs on our website. We also post like updates and things on our social media. So we're at Worth the Wait Charity on Instagram and Facebook. And then the other thing we get a lot of questions about is adoption. So there are some, misconceptions. And Erin, if you don't mind, I got one more slide for this, I think. Misconceptions about, if I'm a cancer survivor, I cannot adopt a child. And I think the biggest thing that I want to share with all of you, and for you to share with other young survivors, is that there is hope. So here's a picture of our very first grant recipient holding his little daughter. And they were able to adopt. He was in treatment at the time. I have a good friend who has metastatic breast cancer. She adopted a baby a few years ago. So there are more challenges as a survivor, but I always like to just let you hear these stories of hope to inspire you. If this is the way that you want to build a family, it's a beautiful thing. And a lot of people say, how do I find out about, a good adoption agency or an ethical adoption agency? This website, Adopt Match, is the best resource that I can recommend. You can actually put your zip code in there, and it will populate a list of the most ethical agencies in your area. And most states have them, but let's say your state doesn't, you can work with an agency that's not in your state, because a lot of times, the birth mother might be located in a different state than where you live. So that is a wonderful resource. And then Erin, on the next slide, we have some other resources that we like to recommend. So for the long-term storage, Verna's Purse is excellent. It's actually a program of Reproductive. And you can apply for, I think it's 2 or 3 years worth of discounted storage, which is excellent. It's a very easy process. You do have to be a US citizen. That is the one caveat for that. The SAM Fund does family building grants for surrogacy, IVF. So that's a great one to check out. The Cade Foundation as well is in the family building space. And then surrogacy is such an amazing option, especially for breast cancer survivors. It is so costly. So there's a wonderful group called the Surrogacy Foundation. They're based out of Georgia, but they do 1 grant a year, at least so far. Hopefully that they'll be able to do more than that. But it is cancer specific, started by a breast cancer survivor. And then BabyQuest does IVF, not cancer specific grants. And then, so hopefully those are some resources you can check out. The other piece is infertility in general is such an emotionally draining experience. And when you layer it with cancer, there's a researcher out at Stanford, Dr. Catherine Benedict, and she calls infertility after cancer a secondary trauma. And I think that's such an amazing way to sum up the mess that this is. So I always like to recommend, reach out. If you need somebody to talk to, you can contact me. We have over 180 people that we've helped that I could probably find somebody with a similar diagnosis, and I'll be happy to introduce you and just hear their story of hope. And then there's this wonderful support group, Cancer and Fertility. All Paths Family Building is another great nonprofit. And so they meet virtually once a month, I believe. So please do not do this alone. There are resources, there are people out there that want to help. And then I will leave you with some of our beautiful worth the wait babies. We have 15 babies and counting that we know of. There's every once in a while I get an email, I'm like, oh yeah, I had a baby 6 months ago. Sorry, I forgot to tell you. So it's always exciting to get these baby pictures and just know that there are survivors out there living amazing full lives. And these babies represent the whole spectrum of family building, from egg donation to spontaneous birth after cancer when they didn't think it was even possible, and everything.
That is amazing. And I love all these photos. I was so happy to see them. I'm like, oh, look at these beautiful babies. I love this. So thank you so much, Megan.
You're welcome.
Excellent. You brought up a good point, and I'll bring all of our panel on. Again, feel free to put any questions in the chat, or if anyone wants to raise their hand and share their experience, we'd certainly love to hear about it. But Megan, you brought up a really great point about support groups and the support that these individuals, the importance of it. And Tamara, I don't know if that's something that you tapped into as well, or you sort of found your group of support going through this process on your own, if that's something you want to comment on.
So one thing I was thinking about while Megan was talking is that not everyone has a Megan to go through the process with them, to be supportive, to look things up, to figure out what those next steps might be. And so one thing I would urge, if there's any medical professionals on this call, is if you do know someone going through this, or a family member or friend, that this is a great area to step up and offer specific support, whether that's researching options, researching egg freezing facilities, or financial support. Because again, if this is something that's happening at the beginning of the diagnosis, it's a very hectic, stressful, scary, sad time. And it just is that much more so trying to smash everything in a short period of time. So I did not have any resource groups that I was able to tap into, simply because of my own doing and just lack of time and being overwhelmed. That's where TikTok came in. But I would say that's a great thing if you are in the area of being able to provide support, to maybe look up some of these resources and share that with someone.
And Tamara, I'm glad you mentioned that, because it was, it was really inspiring to follow your journey on social media. And I do love how you sort of took that and put your journey and your process out there for others. And I'm sure it was wildly impactful to open up that lens to others of sort of what your experience was like, and others feel like they could resonate with you. Amazing.
Thank you.
Dr. Woodard, MD Anderson or other, offering support groups and information and resources, is that something that is commonplace that you offer with your patients, or something that you find, given the speed at which this process moves, may often be overlooked?
So I find, we do have a list of resources that we have available, including, we have pamphlets about worth the wait. We have all of those things, but I think it's really hard because it is a very stressful, busy time, and patients are just getting so much information. They're getting support groups related to their cancer diagnosis itself. Everyone's reaching out to them for studies. So it's really hard. So we try to put printed materials in folders so that patients can go back and look for it if they decide they need it. And I think another thing is, a lot of times I think some of the trauma of it hits like much later in terms of like, oh, I'm worried about my fertility. Yes, I may have done this, but it's bothering me that I haven't gotten my period, or things like that. And we actually have reproductive psychologists locally that we send people to if they're really struggling with some of those feelings.
That's really great to call that out, that there, it would make sense that there is a specialty for working with this type of patient population, because you're right, and sort of that PTSD-esque conversation is certainly something I hear in connecting with our Unite for Her community just after the process in general, right? Like sort of that moment when everything stops and they kind of reflect and say to themselves, oh my goodness, like what did I just go through? So I would imagine that layering fertility and family building on top of that, and it falls greatly into that frame of mind as well. So having a specialist that someone can work with to kind of work through what will that future look like, what may work best for me. It's really great to know that that sort of specialty is available. Amazing. Anyone like to share, while we're here, any questions or experiences on your own, or anything for our panelists this evening? Thank you for sharing your social media. She's a wonderful follow. It's great. I love it. Nina, any other questions that have come through, or anything you want to share or have mentioned from our attendees tonight?
I don't see any other questions. I too love the idea that there's, specific support out there for patients who are going through this. And I don't know if anybody would be able to answer this, but something that just popped into my head is that at one point at Unite for Her, we saw a very, very young child almost be diagnosed with ovarian cancer. Is there a different treatment approach or a different approach for children who, are not at that age yet, that they're even considering family?
Yeah, that's hard. And my experience in dealing with children is that the developmental range is so broad. So I've had an 8-year-old who was like able to say, yes, I want to have children one day. I understand this conversation that's going on. And I've had 15-year-olds whose parents are like, don't even talk to them, and they shut down and don't want to talk about it at all. So a lot of times you have to kind of tailor these conversations to meet the patient where they're at. But certainly, we believe that young people should be having these conversations and engaging in them as much as they can. But a lot of times it's going to fall on the parents. And I don't envy that position of trying to know what your kid is going to want 20 years from now. But we do have counseling and support for those patients and their parents as well.
Amazing. Yeah, I can't imagine having to be with an individual that age trying to make such a mature decision on what the rest of their life looks like. I'm still at all when I think 18-year-olds have to pick their future going into college. I can't imagine having to make this decision about, what your family may look like. So it's good to know that, there are options and professionals like you that can tailor that conversation, and you try to do the best that you can for the family and for the patient.
And if I can add, there's also some tools that researchers are working on to help facilitate those conversations with teens. There's a local children's hospital that Worth the Wait's involved in, and we've been able to submit some video testimonial. So a kid can be like, oh, wait a minute, this is somebody who's been in my shoes before, to kind of inspire them to really hit pause before they say, no, I don't want to do this.
Oh, that's really great to know, because, again, just sort of being able to resonate with someone else and understand what that process may look like, to have that connection, especially at that age and all along the way, frankly, is so important. So that's really exciting to hear about. Wonderful. Okay. Well, any other questions, any other comments, anyone else want to share? We have just a few moments before we wrap for our virtual hangout this evening, but anything else? Okay. Well, thank you all for joining us, our amazing panel. Thank you for sharing your evening with us this evening and providing this really important conversation and resources and personal experience. We appreciate all of you, and thank you so much for your time tonight.
Thank you for the invite. This was great.
Yeah, thanks so much for putting this together, Erin.
You're welcome. Excellent. So, and I want to thank all of you for joining us at our virtual Hangout this evening. Again, this segment is recorded, so you are welcome to come back and work through Dr. Woodard's presentation, re-review the information and resources available through Worth the Wait, and also share this recording with anyone that you may know of or learn of in the future that can find this information helpful. So know this will be available on our UFH Connect video library. I will also say, don't forget about our other education segments that are happening this week. So tomorrow we have our Ask the Expert streaming live at 1 p.m. Eastern time to the Unite for Her Facebook page. Aubrey and I from our dietitian team will be talking all about supplements and cancer. We will be joined by a true expert and fellow dietitian, Natalie Ledesma, and talking all about and answering questions about those common supplements that we hear about, followed by a speaker series tomorrow evening. So 6 p.m. on Zoom, just like tonight, we will be talking all about cardiorespiratory fitness and cancer with a cardiac expert physical therapist. She will be teaching all about the benefit of cardio fitness and preserving heart function. So I always say the heart is the center of us. We want to always be taking care of that. So you can register and view the recording at uniteforher.org/UFH Connect. And then I want to give one final thanks to our education sponsors. So tonight's virtual Hangout was presented through Unite for Her Connect by West, Merck, Lilly, Novartis, and Gilead Sciences, with support from our gold sponsors, Pfizer, GSK, and Daiichi Sankyo, with additional support from AbbVie, Terri Therapeutics, and Veristem Oncology. So thank you to all of you that joined this evening, and to all of our panelists. Hopefully I will see you again soon. Nina, thank you so much for joining me tonight, and I hope everyone has a wonderful evening. Take care, everyone.
Thank you.